I'm Jasmine Sasaki, founder and executive director of WeCare Tennessee in Memphis, Tennessee. WeCare Tennessee is an organization that specifically supports Black transgender women who do sex work and use drugs in the communities around them. WeCare Tennessee partnered with 20 transgender and non-binary leaders from across the country to develop a strategy known as Project U.S.E. Project U.S.E. is an acronym that stands for Understanding Sex Workers' Experiences. In the work that we do, we found that there are many experiences brought to us that we may not fully understand. Project U.S.E. includes a survey that assesses the needs of transgender women who do sex work and use drugs. These experiences need to be researched by the people themselves and not other researchers. Project U.S.E. allows the opportunity for transgender people to research themselves so that we can understand the experiences better and provide more intentional, impactful services. In Puerto Rico, the United States Conference on HIV/AIDS and the National Harm Reduction Conference were happening in the same week. WeCare Tennessee uses as a prime opportunity to take the momentum that people have for those conferences and implant a Black Transgender Leaders Conference.
I need some calming energy. I'm very anxious right now. Thank you. So I am very excited and honored to be here. This conference is an amazing space for all of us to be in at a very amazing time. It is right after the United States Conference on HIV/AIDS. So some of us, if you've been here since U.S.E, make some noise. Woo! Y'all are lovely. So you all understand how important it is, okay? My sister's up there, she's happy, she's gonna enjoy. But you all understand how important it is to not only be in one part of the conversation, but to be in another part of the conversation. And continuing those conversations is instrumental to the work that we do in harm reduction and also HIV prevention. So shout out to the people who have been in both conferences. And it brings me to, oh yes, let's give them a hand. And to those of you who are not able to be in both spaces, don't feel bad, because this work can be done all year round as long as you're at whatever conversation needs to be at when it comes to the community and the demographics that we serve and the participants that we engage. So that brings me to talk about WeCare Tennessee.
At the conference, the leaders had an opportunity to not only get to know each other better, but to bounce ideas off of each other, talk about strategies that they currently use, and develop a collective strategy that is even more intentional for our community.
My name is Dr. Tatiana Moten. I'm a Senior Capacity Building Specialist for San Francisco Community Health Center. I'm here as one of the Black transgender leaders for the pre-conference organized by WeCare Tennessee. And I'm also a Black transgender woman. Let me say this first. I'm very passionate about my community and the things that are affecting them. So if I had to say if there's one thing that I could say that I care about, it's my people. So what are the barriers that exist for Black trans women who are involved in sex work and healthcare and housing? Well, namely, one of the ones that I am most familiar with is being taken serious. When they come into those type of settings and they will express some of the issues that they are experiencing, and honestly getting into care is the hardest. When you're dealing with providers that are not culturally competent, that will try to create this false narrative that they don't have the experiences, and I'm one of those persons who will throw in their face, you've taken anatomy, you've taken physiology, and so what's different? But there's a cultural competence piece that has to happen for those people, and that happens through exposure. Unfortunately, most of our medical institutions and learning institutions do not require that doctors or providers go through a clinical rotation of LGBT cultural competence. And so in my role previously as an HR manager of diversity and inclusion, that was very, very critical for me to have all of the providers at all 13 of our clinical sites go through a rotation or training surrounding trans and non-binary identities and that cultural competence. But as it pertains to housing, that there is not enough programs there. And most of the programs that are existing are for those people who are living with HIV. And the reality of it is, yes, we know the numbers that 2 out of 4 trans women or of Black trans women will contract HIV or are living with HIV. And so when I think about that in the context, myself and 4 of my friends, out of those 4, 2 of us are living with HIV or will very soon be. And so as I'm talking about housing, there are not a lot of programs that are existing. And so for those people who are still actively involved in sex work, for them, the disparities are even higher. And so those numbers that I just gave will be doubled and tripled because of the risk. And so it's important for us to address those who would be considered high-risk negatives, because those are the people who critically need those services before they get to the point of care. And so for us that are involved in public health, I would say it's very, very important for us to address a lot of those disparities before we can start moving forward.
My name is Toy Washington Reynolds, the Executive Director of the Trans Women of Color Healing Project. I believe that research is a very vital thing that supports the existence and community of any demographic. And when research and data is not represented for that data, for that demographic, I don't believe that we get the best possible tools and resources to meet the needs of that community. I do believe with that data, we can create programs and services to better support them in the work that they do, because at the end of the day, they're working with community and they're leaders in community. And once again, I believe that if we support our leaders in their personal lives, it can manifest and it can be shown and manifested in the work that they do toward community. I believe the next action step should be having more events like this, having more conversations, creating more spaces where this conversation can be had. Stigma-free, judgment-free. Just creating a space where everyone is able to self-identify, be themselves. Let the community tell you what they want. Let the leaders tell you what they want. Don't insert who we are, our beliefs into it. Once again, take a harm reductive approach. Take us outside of it and make sure that we're creating a space and we're creating an environment that allows individuals to be themselves so we can get the best representation of them.
My name is Toni Michelle Williams. Number one, I am a Black woman of trans experience, born and raised in Atlanta, by way of Virginia and the Czech Republic. Shout out to Prague, study abroad program. I am also a favorite cousin. I have little babies that my auntie has blessed the family with. I am an entrepreneur and leadership development coach. I'm also the executive director of the Solutions Not Punishment Coalition. So I am a former sex worker. I am a person who have used drugs. My drug of choice is marijuana, of course. As a former sex worker, you know, my experience was primarily through survival. I was introduced to sex work through, you know, the work of supporting trans women. And so when I left college in 2012, it was like my primary means of work, in addition to working like at a nonprofit who was, you know, as a healthcare outreach specialist. And, you know, you made no money doing that. You know, you made enough to like eat and afford your hormones probably, and like to get to work and get back, and to have a little fun here and there, but to pay your bills. But other than that, you know, it wasn't enough for me to survive and thrive inside of the visions that I had for myself. And so, you know, I turned to sex work, and I'll be honest, it was literally there are so many contradictions. So on one hand, it's literally like a liberating experience, right? I'm feeling more alive in my body. I feel more firm in my body. I feel more powerful, right? And I feel that I have more agency with my body as a sex worker. And then there's this other contradiction in like those moments where I just don't, you know, it's just like I have to conform to what is asked or expected to me from the date, you know, I'm constantly worrying about, police interactions, and if, my safety or my freedom would be taken away from me while I'm trying to survive. Also worried about, contracting STDs and HIV and other diseases that, will harm, again, this vision that I have for myself. And so I never really had a time to rest and enjoy sex work back in the day. I think the evolution of sex work in like this digital sphere with OnlyFans and other things is also is very liberatory. I don't necessarily participate in those things now, but I am a fan, darling. I'm not the only fan, but I'm a fan. I think that the girls, again, have more choice, and folks in general, a lot of folks, different identities and experiences engaged in those platforms. And so I think they have more agency and control of the content that they create. They have more, say-so in the things that they share. They're able to express and extend boundary in ways that, you just can't in person. And so I definitely think it's a different generation in a new time of how we should be viewing and identifying the possibilities of sex work in ways that folks like Nina Simone and Maya Angelou just couldn't in the past. Being a sex worker can isolate you and also trigger you into a place of shame that could take years for one to unravel and to befriend again. I have dealt with a lot of shame around my body and the dysphoria that I have around my body. Sex work has, like I said, put me in different contradictions to where I'm liberated, but then also I feel so much shame and disgust, about the actions and behaviors that I've needed to take in order to survive. It has prevented me from making necessary requests that I need in order to, get the things that I want and create the things that I want that serve the visions that I have for myself. And I think that is, I think everyone deserves the space and the time and the grace to do that visioning, to have those strategies and support to develop those strategies. And when you have suffered from isolation, when you've suffered from, the trauma of rejection, over and over again, it makes you feel like you don't deserve the things that you ask for. And I've definitely experienced that in my lifetime. And as a somatics coach, I've definitely seen that happening in people's bodies over the last 6 years that I've done this kind of work.
During summer 2022, WeCare Tennessee partnered with the University of Memphis School of Public Health to create and administer a survey that would help WeCare Tennessee create new programs and offer more services for transgender communities, particularly those who have experiences in sex work. We could not have done this work without the support of 20 committed community ambassadors identified by WeCare Tennessee who share this survey within their community networks. This anonymous online survey was composed of questions related to lived experiences with stigma, drug and hormone use, HIV vulnerability, and HIV protective factors, all of which are some of the well-documented issues within transgender communities. Survey findings show that 77% of women were using hormones, and a majority reported experiencing mistreatment and stigma, lower quality health care, exposure to drug and alcohol use, and physical and/or sexual violence. Of those that inject hormones, 89% reported using estrogen, and 72% reported using a different needle each time, a positive sign of harm reduction behaviors. However, these results also show that in the past 12 months, 30% of respondents use hormones that were not prescribed to them. This is an area of concern. 31% of respondents do not have a healthcare provider they feel fully comfortable with, and 34% of respondents reported being denied or given lower quality healthcare. Outside of healthcare, 78% of respondents reported having been called names or insulted, 55% have experienced sexual violence, and 46% have been physically attacked, numbers much higher than the general population. Additionally, this survey showed that 39% of respondents reported having lived with someone who was an alcoholic or problem drinker in adolescence, and 35% lived with someone who used illicit drugs or abused prescription medications. Experiences like these that occur in childhood may be linked with poorer health in adulthood and therefore are important issues WeCare Tennessee intends to address. WeCare Tennessee wants to ensure we are doing our part to positively support transgender women. We will use this information to provide more mental health and support services and other resources for transgender communities in the future. Project Use was also a way for transgender women who do this work to find community, to find their people, and to know that they have the support that they need to do the work that is so important to all of us. This project will be something we continue for the next 2 years, where we will integrate 20 new leaders every year, and we will continue to develop and edit this strategy to make sure that our work is not only good for us, but the best for all.